it's me, Kim Liana, and I'm back at CSA Medical Aesthetics. On my last visit here, I had my temple, cheek, and chin fillers done to create a V-shaped contour. And today, Dr. Contessa will be treating a pimple mark on my forehead with Hollywood Spectra, which can help improve skin tone and texture. Napansin din ni Doc na my lips are uneven, kaya naman she will do a little enhancement on my lips. Don't forget to like, subscribe, and hit the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be featuring a new device, the latest in Q-switch laser technology. But before that, let's all welcome back our CSA ambassador, Miss Kim Liana.
Hi!
Hello! Okay.
Hello.
So before we did the procedure on her, we did like temple filler, under eye, also some chin filler there. And then right now I'm looking at Kim Liana. Wow, there was a big improvement. And also I noticed the left side and the right side of the face, they're balanced. Okay, we also noticed in the past some asymmetry. Actually, asymmetry of the face is common. Okay, the right side can be smaller than the left side, or some individuals would say my left side is saggier than the right. Okay, so we also do a balancing treatment, and I'm noticing right now there's this symmetry of the right and the left. Did you notice that, Kim?
Yes.
Liana. Dalawang pangalan eh. Okay. And of course, in beauty, we define beauty as symmetrical, within proportions, there's balance, it's harmonious. That's the real beauty, okay? Because others are like, when they wanna treat a part of the face, for example, right now, they're doing lip augmentation. When you do lip augmentation, it should also be balanced with the other parts of the face, like the nose, the cheeks, the chin. Don't make your lips overfilled because it's no longer within the rule of ratio and proportions, or the balance or the proportion face, right? Anong comment mo doon, my dearest Kim Liana?
Yes, agree po ako doon.
Yeah.
And yun yung benefit talaga ng non-surgical procedure.
Yeah.
Kumbaga, doctors can
Right.
tailor procedures depending on the assessment niyo po. Diba?
Yes.
Saka yung preference din ng patient.
Exactly, okay. So also we ask our client, okay, what do you prefer? What do you want to achieve? And we want something also natural. There you go. Like if you do your lips, dapat natural looking pa rin. Not the too much of a lips eh. Because I have patients coming to me, Doc, I don't want to have those like duck lips, okay? I don't want to have those like sausage-shaped lips. I just want a refreshed look. I just want to restore the volume and also restore the contour, okay? Because later on, because I was checking on dearest Kim Liana, okay? Ganda ng batang to eh. So, lips niya, I noticed that kind of narrower yung left, this one.
Yes.
The left upper part. Kind of shorter as compared to the right side. So, we want to do also a balancing in the lip region, but not overfilling the lips. Okay? And, may problem kami ni Kim Liana ngayon. She had a pimple on the upper part of the face, the forehead region. So, this side here, the left side ng kanyang forehead. She had that 2 months ago, right?
Yes, po.
She had a single acne lesion and she was sharing with me. It was red, so it means to say it was an inflamed pimple, okay? And then she applied a 0.1% tretinoin. And then, so anong nangyari?
And the next day po, Doc, parang
Yeah.
like blister siya.
Blister, and it was red.
Yes.
And was it tender when you touch?
Yes,
Masakit?
as in,
Ayun.
masakit.
So, she applied this tretinoin, 0.1%, just on the acne area. And what happened, it kind of like lead into that reaction. So, it got irritated to a point that there was a blister, a fluid-filled skin lesion already. Meaning to say, nagkaroon na ng skin layer damage there or some of the epidermal layer there na ano na yung mga cells kumbaga na burn or yun, nag-induce ka ng injury to the cellular tissue. And of course, infections will also set in when you have already that kind of a blister or any skin damage there. And it left a mark. Yan ang problem niya ngayon. So, nagkaroon ng what we call post-inflammatory pigmentation, or for her case, it's not really that brown pigment. I notice it's more of a reddish one. It's what we call post-inflammatory erythema, okay? Na induce lalo yung redness, okay? PIE, we call that PIE. It's different from the PIH. So what kind of procedure, what treatment will we do to help Kim Liana with this concern? We'll show you when CSA Medical Aesthetics return. And we're back. So, the first thing that we will be doing for Kim Liana today will be the lip area, okay? Before I do the laser, the machine, I'll start with the lip region. Okay, a while ago, I was doing an assessment for her. I noticed that on the upper lip region, okay, the right side has this kind of width, okay, comparing it to the left, okay. Kind of the left is narrower. And this is kind of the upper lip region is downturned like this, giving it like a thinner left upper right. Tama ba? Yeah, left upper. Left upper side, okay? This part here. So we wanted to improve this upper lip here, the left side here. We want to kind of flip it like that. And at the same time, elongate it, okay? Now, the lower lip has a good volume. Okay, now the lower lip should be thicker than the upper lip. So, dapat yung lower lip natin has more volume than the upper lip. Okay, but the upper lip should have a good projection, about 2 to 3 millimeter projection. Okay, so this is lip aesthetics. Okay, so we should just follow those kinds of rulings. Okay, so for my technique, I'll be combining needle and cannula methods. Okay, so for cannula method, I'll be working on this side here, the left side here, and then I'll clean the area here and make a tiny entry point here, and I'll pinch. Okay. So pinch the skin there, and this is my entry point. And here it's a tiny prick. So actually, I'm using a gauge 21 introducer needle there, and I have a gauge 25 cannula here. And so I have to look for that entry point and then perpendicularly guide my cannula towards the upper lip region right now. And this one is gonna be in a plane, ideally subcutaneous plane here, okay? Because we don't want to go to the deeper plane where you have a labial artery there. So the upper lip is supplied by the so-called superior labial artery, okay? So we're just gonna move this cannula towards the upper. So I'm just gonna move and just glide this part here, okay? going up and up. So again, a superficial plane here. So we avoid the deep plane to avoid the superior labial vessel. And I'll push a little bit of my product, just minimal there. Usually for one side of the lip, like for example, this left upper lip here, I can use 0.2 ml only. Okay, and I'm going now in the vermilion, the lip body part, and pushing a little bit. So the goal here is to widen this upper lip section here. So again, going back. So it's a panning. It's a panning method. And I'm using a Restylane kiss here. So Restylane is one of the OBT products of the Restylane Galderma. Okay? And Restylane has been there for like since 1996. It's been there for like 27 years, something like that. So it's guaranteed safe, proven safe, and several studies were already presented with it. So I already noticed a big improvement, so I still need to use a 0.2 there. Are you okay?
Yes.
Yeah, so let me know if there's any pain, okay? Because others are thinking that this treatment is painful, but I'm using a cannula. It's blunt, it's not a needle. It's not sharp, okay? I'm just gonna fill in a little bit more there, some volume more in that body part of the upper lip, okay? So there you go, just a minimal amount. So I'm done in this part here. So actually I can just hydrate the lower lip region using the same entry point, and we can go directly to the lower lip, the left. Even the oral commissures, they will need to be treated. So I'm just gonna be filling in a little bit into this lower commissure here, upper and lower oral commissure, just a little bit, just to improve this corner of the mouth. Some cases I noticed they have hyperpigmentation around the lip area. So we can also use hyaluronic lip filler to improve those pigmentations, okay? So kind of some resistance because we are in this section whereby we have a so-called modulus. These are like connections of different muscles from the mid face and the lower face. So they connect in this region. That's why sometimes you encounter some resistance in this area. And I'm just gliding towards the lower lip. I just want to hydrate the lower lip. Just use 0.1 ml here. Just to give that, still maintaining the good volume and hydrating the lower lip. You're still okay?
Yes.
Yeah, good. So we're just gliding it there. And I'm in a superficial plane. I don't want to reach the vascular tissue, the so-called labial artery, inferior labial artery. I just want to be in the right anatomical layer, okay? So filler injections are safe when you inject it into the right tissue plane or tissue layer, okay? Just a 0.1 there, and I'm looking at my syringe, and that's already good. Okay, so we did an improvement already. Looking at the left side, somehow it's already balancing with the right upper lip, okay? So check again, okay? The right is really better than the left, okay? We were discussing a while ago, Liana and I were talking like her right side is better than the left, right? Even when we were doing your face symmetry correction, your problem was your left side of the face. So this left side of the lip also is a problem, okay? And of course, we wanted to balance our face, the left and right side. We want symmetry there. And I just need some more correction here on the upper. Okay? So just a little bit. There you go. So what I'm gonna do now is use my needle, okay, needle technique to further improve this upper lip. So what we can do is the so-called lollipop technique, okay? So I'm combining needle and cannula. So I'll be using like a needle right now. So this is for the lollipop technique. If you wanted to flip the upper lip, so the entry point will be at the vermilion border, okay? So you have to look for the bevel of the needle, ideally bevel up, and you can inject it from here to the and push just a little bit of your product there to cause this so-called lip flip. Some will have this lip flip technique using the so-called toxin injections or botulinum toxin. You can also use that. When you use needle, you expect some pinpoint bleed, right? So pinpoint bleed, and then we're gonna press on it and then inject again. So we wanted to improve this left side of the upper lip. Are you still okay? Yun lang. Some pinpoint bleed. And then one more here, and we're gonna proceed to the other side. So the lip treatment we're doing for you is more of balancing. Okay, actually you have your good lips already. It's just making it symmetrical, okay? So our goal is just to balance everything. Okay, if we assess the left and right side, so left is already almost equal to the right. So as if like I don't need to do anything on the right. Okay, so later on I'll show it to you. So I already used like 0.55 mil of my filler Restylane case here, okay? So for the right side, what I'm just gonna do is a little bit of the lip flip only, okay? Just a little bit na lang. So combination technique and a little bit more on the other side. Just a little bit there, and pinpoint bleed is expected, okay? It's important that the doctors are really focused in what they're doing whenever they're injecting, because we have to really know the different blood vessel supply, because there are dangers in doing these kinds of filler injections. That's why you should only go to those who are authorized to perform this. One more here, and then I'm just gonna finish on the lower lip area. So let me just do the right side, okay? So for this one, we'll just do the so-called needle method because I don't need to widen this anymore. We just wanted to restore contour and volume on this side. And then after that, let me just do the lower lip. And we also wanted to give her the so-called cherry lips. You've heard of the cherry lips?
Yes.
Okay. So we will do the cherry lips, the so-called like having your lip tubercles. We'll just emphasize the lip tubercles. And how do we emphasize the lip tubercles? So what we're gonna do with that is we'll use like an applicator stick and place it on the center of the lower lip, this part here, and press and create the so-called lip tubercles left and right. So I'm working on the right lower lip here. Just enter in this inferior aspect, the vermilion border inferior, and push your 0.05. Okay, half of 0.1. Okay, and give that volume there, give that projection of the lower lip there. So half of the 0.1 here, and the other side will be other half of the 0.1. So we did a while ago here a cannula method on the left side, on the right side more of the needle method, and right now we're doing the lip tubercle. So this one is to give that projection, two projections of the lower lip. So we can add a little bit more. Okay. And actually, if you want to maintain this tubercle, what you can do at home is like do apply an applicator stick on the center of the lower lip to create that kind of dent in the center, but two bumps on the sides. You get that? Easy to do, right? Okay, one more here and you're almost done. Okay, just to give you that bump, another bump. That's the thing when you use needle, expect to have this pinpoint bleed. Okay, almost done. And after that, we do the massage. So we have done lip improvement, lip balancing, and the creation of the lip tubercles. Let's do the laser later on. So my treatment indication for now is this so-called PIE here. It's just tiny. It's just like a circle here, which could be around 15 millimeter, 10 to 15 millimeter in terms of its diameter, okay? And I have with me my Hollywood Spectra. This is the latest Q-switch laser, where I think the first one to have this here in Central Luzon. There are old Spectra machines, but this is the latest from Lutronics, the so-called Hollywood Spectra, because they have additional functions and additional tips and they have this so-called MDF right now, and they have improved their technology. So this is a good device for those who wanted to treat their melasma right now, even inflamed acne scars. They want to rejuvenate their skin, balance the skin tone, improve the texture, and even all skin concerns. It will help us with this one, okay? Those with problems of vascular pigments, vascular conditions, pigment birthmarks, okay? Nevus of Ota, nevus of Ito, those with freckles, those with seborrheic keratosis, actinic keratosis, solar keratosis, okay? So we can use this device and multiple indications, a lot of uses, a lot of functions, okay? So this one, I love it, and this is backed up by scientific studies, okay? So it will improve the skin condition, the skin tone if you want to have glass skin or like porcelain skin, light bright skin, flawless skin, clear skin, pimple-free skin, wrinkle-free skin, lahat na, all of the above, okay? So we're just excited to have this device right now. I'm really recommending this to you all, guys. It's painless. Actually, I can even do shot on my arm right now. So pressing on that one, and do it also on my arm area, and it's painless, okay? And we're now doing the shot here and a shot there. So we can do multiple passes, okay? There you go. Okay, did that hurt? And we're done actually. So this one has a laser energy, Q-switch laser, that targeted the vascular condition, the vascular concern. So we wanted to get rid of the redness there, and we'll just wait for the result to be seen, okay? So this is a gradual improvement. Like few days from now, we'll notice that the redness is decreasing already, and there's a healing. It has collagen stimulation also. And I'm looking at the skin layer, the surface. We were discussing a while ago that it seems like a little bit of a depression there, but we'll give it time for repair, because some of those who had this post-acne, kind of like temporary depression, over time they will also heal, they will repair. So we'll just check if it's gonna be elevated or not. If it's not elevated, then we're just gonna inject dermal filler, okay? So initially expect some redness because we did some laser device here. It has some thermal heat there. So we will observe this one, and we'll also do a Hollywood laser carbon peel for you, okay? And we'll follow her up. We'll see the improvement. We'll show you it's gonna be a journey with Kim Liana. So for now, okay, let's show the result of her lips plus what happened to that PIE on her forehead when CSA Medical Aesthetics returns. And we're back, so we'll show the result to our dearest CSA Ambassador Kim Liana. Here's the mirror, there you go. So we did the lip enhancement, the lip improvement, okay? And also we used the Hollywood laser, the Hollywood spectra, for that PIE on the forehead. And right now, I'm seeing like an improved lip region. So I noticed already that there's a balancing of the left and the right, particularly upper lip region. Okay, a while ago, because this was narrower, plus at the same time shorter and kind of like inverted. Okay, we were able to invert it, the so-called lip flip, and also kind of stretch it horizontally to balance with the right side of the upper lip. And the lower lip, we restored again the volume, and we were trying to create also some tubercle on the lower lip region. So, feedback or comment?
I love it, though. Kasi,
yeah.
pantay na talaga. Before
Yes.
po kasi I had braces, no?
Ah, okay.
Kasi dahil akala ko po, yung uneven lips ko, dahil sa, akala ko sa teeth po siya.
Yeah.
So, hindi
So
pa rin
really,
na-correct.
Yeah,
Pero
right.
ngayon, with the help of fillers po.
Yes, the Restylane Kiss.
Yes.
Okay. And the good thing with the Restylane Kiss, it's a product that is also flexible and soft, that it is really blending well and integrating well with the tissues of our lips. Because our lips, of course, they're soft and they're movable. So we always talk. So the filler should also move with that dynamic lip region. So we need some product that has a good contour and at the same time also follows the expression of the lip region. Something soft and flexible, something that has good also a good stretchability and elasticity. So that's why I like the OBT product of the Galderma Restylane, specifically the Restylane Lips for the Restylane Kiss for our lip region. So very specific product for the lip area. There you go. So after this, just do some cold compress, okay, and expect some tenderness or like minimal swelling, okay, and then over time it will further improve, and then we'll see the follow-up, what's gonna happen, okay. And the next one that we did was just having those shots of the Hollywood spectra laser to improve the PIA. Actually, I'm already noticing kind of like a decrease in the intensity of the redness. So gradually, you'll notice the redness will go away. So we'll watch out. Let's observe. So when will the redness go away? The PIE, we call it PIE for her. It's not the PIH. We'll observe when will it be totally gone or when will it fade. Okay, so we'll follow Kim Liana's journey with this kind of treatment. That's why we also advise those who have this like acne problems, especially if they're infected or inflamed, don't just self-medicate, okay? It's important that you seek consult also and seek the help of our professionals, because we know what to do, and plus how to prevent any complications like PIE or PIH, okay? So lesson learned, okay? Because the medicine that you're applying, okay, it might be too strong for your skin type. That's why we also do skin analysis. We have to identify what is your skin condition. Is your skin sensitive? Is your skin kind of like might be reacting to a certain topical cream, okay? Don't just put anything on your face, otherwise it might leave a scar or a mark, okay? So we've learned the lesson there. Thank you so much.
Thank you po.
Okay, we really appreciate you. She's so beautiful, and I also love the effect of the triangle of youth that we've done on her, the temple, the cheek, and the chin. It really gave that good V contour. So thank you so much for sharing your precious time with us, for helping others also to kind of know or learn like what to do and how to improve specific concerns on the face, right? We've done basically a lot on you already, okay, and we appreciate you. So we're glad we're able to help. So for those who have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page and Instagram account, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 093-3860-9193 or 0917-504-4268. And if you wanna watch the other episodes, other videos of Kim Liana, just look at our YouTube channel, Contessa Salvador. And do you wanna invite them on your Instagram account?
Okay.
If they wanna ask you, is it painful?
Yes, we want
how is
questions.
it? If you just wanna share a bit of your experience or your comments.
Yes po.
Yes.
You can freely message me po on my Facebook po, Kim Liana, and Instagram po is Kim Liana DP.
There you go. Thank you. So, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.